Hi, I'm Natalie. I'm a physical therapist here at Back to Life Physical Therapy. I'm so glad that you could join me today for this workshop. If you're joining me today, there's a good chance that you or someone you care about deals with pain on a pretty regular basis. And so as we go through this workshop today or this video today, I hope that you start to gain a better understanding about how pain works, why we have pain, what are some things that make our pain worse, what are some things that might make our pain better, and how we can start to manage and live with the pain that we experience, since pain is a natural part of the human experience. As we go through today's presentation, I'll be going through a little bit about what happens in the body when we experience pain, what happens in the body when we experience injury, as well as managing some strategies or developing some strategies to learn to respond to pain, as well as manage our nervous system. So I'm going to go ahead and share my screen here so that you can see some slides that I've prepared for this presentation. So we'll go ahead and start off right off the bat with one of the strategies that I like to implement, which is demonstrating to yourself physical care. So take a moment and maybe close your eyes and just notice what's happening in your body in this moment. And then see if there's anything that you can change in your body to allow yourself to find a little bit more ease. And so for some of you watching, you might be able to find a position where you're completely comfortable. For some of you, it might just be maybe 5 or 10% more comfortable. And since you're watching this video, most likely by yourself at home, that means you can also choose any position that you might want to be in. Maybe it's lying down, maybe it's standing, maybe it's sitting. And so once you've found a position that's a little bit more comfortable, let your hands rest somewhere on your body. Maybe your hands rest over your heart, on your chest. Maybe they rest in your lap, or maybe they'll rest somewhere on your body where you experience discomfort. And as you feel your hands on your body, bring to mind someone in your life who you care about deeply, but also someone who you don't have a very complicated relationship with. So this could be maybe a pet, a child, a dear friend. And notice first just what happens in your body. What do you notice in your body when you bring this person to your mind? And then imagine that this person is going through something difficult. Imagine maybe that this person or this pet is experiencing discomfort, maybe like the discomfort or the pain that you feel. Notice the care that starts to build in your body for this person. And as you feel your hand on your own body, imagine that you could send all of that care through your hand into your own body the same way You might demonstrate care for this loved one if they were experiencing something difficult. And if it feels good, if it feels natural, maybe you start to rub your hand from side to side or gently pat this part of your body the same way you might use, same strategies you might use to demonstrate physical care for a loved one. And just notice what happens in your body as you begin to demonstrate this type of physical care towards yourself that you might otherwise demonstrate towards someone else. Take a moment to notice what's shifted in your body, if anything. And then when you're ready, you can go ahead and open your eyes. We'll take a look at our plan for the next hour or so. So as I mentioned, I'll be going over how our tissues get injured and how our tissues heal. We know that not all pain that we experience is from a tissue injury. Maybe we have some sort of disease or something that might be causing pain that actually isn't causing tissue injury. But oftentimes we associate pain with tissue injury. So it can be helpful to understand how our tissues heal. And then since everything that we experience are all of our sensations, all of our movements, all of our emotions are all processed through our nervous system, we'll learn a little bit about the nervous system and then how our nervous system processes pain. And throughout all of this, we'll be incorporating various strategies. We've just used one. And at the end, we'll review those strategies and then talk about some places where you might be able to find some more support. So we'll begin just with a question. Maybe you can answer this out loud. If you're watching by yourself, maybe you want to write down your answer. But my first question to ponder is, what is pain? So based off of what you understand at this point in your life, what is pain? And I'll give you a moment to just ponder that and write it down, or maybe say it out loud. And then we'll look at one potential answer. So there's a lot of different things that you could have said in response to that question. But this definition comes from the International Association for the Study of Pain. So from a bunch of folks who study and understand pain. And what they've come up with, what they've proposed is that we consider pain an aversive sensory and emotional experience caused by or resembling that caused by actual or potential tissue injury. And so what does this mean? We've got a few different layers to unpack. One is that the experience of pain is aversive. It's not pleasant. And then there are two different types of experiences that we could be having, and we're probably having both at the same time. One is sensory, right? So we can think about sensation as what we feel in our body, right? Or on our body. So for example, if you were to take your hands, another way of demonstrating physical care, and maybe just rub your hands together, you would feel the touch of your hands against each other. If you were to give yourself maybe a little squeeze on your hand or your forearm, maybe your legs or your thighs, you might be feeling the pressure of your own touch. Or maybe if you put your hand down on the table or the chair that you're near or that you're on, you might feel the temperature of that table or chair. That's all sensation. But then there's also an emotional component to this sensation. And sometimes when we hear about that emotional component, there can be a little bit of maybe resistance, maybe defensiveness, maybe even shame that comes up, understanding that pain is not just a sensation, but also an emotion. So just notice if that's something that's coming up for you. And that this whole experience, or maybe these two experiences combined, are caused by something that injures our tissues, which could be, maybe a fall, you scrape your knee, maybe it's a disc that gets injured in our back, or maybe it's something that's a little bit more sinister, maybe a disease that's affecting our organs. But that it can also be caused by something that just has the potential to cause that type of injury. So for example, if I were to take my pinky, and you can try this at home as well, if you begin to bend your pinky backwards, first you might start to feel stretch, and then you might start to feel some discomfort, and then you might start to feel, ouch, that hurts. And that hurt isn't because you've actually injured your pinky, but that you could have the potential for injuring your pinky if you continue to bend it backwards. And so it starts to become a little bit complex with our experience of pain. And so sitting with some of that complexity and sitting with some of that, that maybe shame or whatever feeling might have come up as you start to think about the emotional component of pain, brings us to our next strategy, which is demonstrating to yourself emotional care in the same way you might for a loved one. So again, go ahead and find a position that allows you to be a little bit more comfortable. I just did. You might have heard my stool adjusting. And again, that might be just 5 or 10% more comfortable than you were before. And then close your eyes if that feels comfortable. And again, maybe put your hand over your heart or let your hands rest somewhere where they feel good. And just start to notice maybe what types of emotions, what types of feelings come up for you as you start to think about your life living with pain. Or maybe as you start to think about what you experienced when you thought about pain as an emotion versus pain as solely a sensory experience. And sometimes there can be some really, really strong feelings that come up here. So I encourage you to choose maybe one of those feelings that's not quite so intense, one that you could actually sit with for a little. And at first, just notice what it feels like. Notice the experience of having that emotion. And then maybe say to yourself, give yourself some reassurance about this emotion in the same way you might to someone you love. Think about the experience of what it's like, of what this emotion is like. And say to yourself, yes, this is hard. Or maybe something like, yes, it's difficult to live with pain. Or yes, it's difficult to live with this emotion. And then as you sit with that, you might start to call to mind or start to notice that this experience of pain or this emotion that you're sitting with, that there are many people in the world who are probably dealing with something similar. That you are not alone in what you're going through. And think about the way that you might sit with those feelings if you were sitting with someone that you cared for. Think about the compassion, the kindness that you might demonstrate to that person that you cared for if they were going through something similar. And allow yourself to demonstrate that same kindness towards yourself. Yes, I see that what I'm going through is really hard. And yes, sometimes it feels like maybe I can't get through it. And that's a very human experience. We all encounter things that are so challenging. We don't know if we can get through it. And that as I hold that emotion, hold that experience, may I demonstrate compassion and kindness to myself. Or maybe you find another word, another set of words that feels more appropriate to you. May I be kind to myself as I face these hard feelings, and as these hard feelings affect how I live my life. And then again, just notice what happens in your body when you demonstrate that emotional care, that emotional compassion towards yourself, the same way you might to someone you love. And then when you're ready, you can open your eyes and we'll continue. So we'll begin to talk a little bit about tissue adaptation and tissue injury. So I begin with tissue adaptation because I want to remind us all that our bodies have this incredible ability to adapt to the world around us. And when I talk about tissues, I'm talking about any sort of tissue in our body. This might be muscle, it might be ligament, it might be an organ, it might be bone, it might be nerve tissue. And that every single one of those tissues has the ability to adapt, though they're all going to adapt a little bit differently, depending on what the tissue is. And when we think about tissue injury, this is when our tissue experiences damage that's caused by some sort of force that exceeds the tissue's ability to adapt. So for example, if I were to start going to the gym and I placed a weight in my hand, that's going to be adding a force to my body that my tissues have to adapt to. Now, I'm not very strong, so if I went to the gym and I started to lift weights, I would probably have to start with some weights that are pretty light, 5, maybe 10 pounds. And then over time, as I continue to lift weights, I might be able to increase the weight that I'm lifting. That's adaptability. But for example, if I were to go to the gym and I got really ambitious, or maybe I was starting to get stronger. And so instead of going from 5 to 7 pounds, I went straight from 5 to 20 pounds. And I did the same type of lifting that I had only been doing with 5 pounds. That force, that external force of the weight might be too much for my tissues to adapt. And it's possible that I could cause damage or injury to my tissues. Now, the good news is, since our tissues have the ability to adapt, they also have the ability to heal. Healing is another way of thinking of adaptation. And that healing occurs in every single one of our tissues, but it's going to look a little bit different depending on the tissue. For example, if I injure my skin, not very severely, so the type of tissue and the severity of the injury are going to affect how well it could heal. So for example, if I fall and I scrape my knee, that tissue is going to heal pretty well. You probably can even think of a time when maybe you fell and scraped your knee and there's no sign of that scrape on your knee anywhere. But maybe you've had another time where you've fallen and scraped your knee or scraped some other part of your body, and it actually left a scar because maybe the injury was a little bit more severe. That scar still works pretty well, almost as well as the rest of your skin, but you might notice that maybe that scar is not quite as flexible as the rest of your skin. Maybe every once in a while that scar could feel a little bit tight. And that's because the tissue that is used to replace the injury or the tissue that was damaged is not quite the same as the original tissue. And this whole process of healing follows a pretty predictable pattern. First, we have an inflammatory phase. So in the case of falling and scraping your knee, for the first few days, maybe week after the injury, you might notice there's redness around the tissue. You might notice that it's hot. And all of that happens so that your body can clear out any sort of waste product to decrease the likelihood of getting an infection. In that time, lots of blood will be sent to the area. And then over the next few weeks, you're going to get something called the proliferation phase. And in that phase, basically our body starts to place down scar tissue. But it does it in this really haphazard way because it wants to close up the wound as quickly as possible. And so over the next few days, maybe weeks, and in some cases years after that, your body is going to start to remodel the tissue. And that remodeling has to do with tissue adaptation and the way that we actually place different forces on our tissue. So for example, if I get a scar and a scab, that's going to be less mobile tissue for a while. And then as I begin to move my knee a little bit more, over time, it's going to start to remodel that scar tissue so that it begins to behave a little bit more like the original skin that was in its place. So with that, I've got another question for us to ponder, which is pain an indicator that tissue injury has occurred? What do you think? Yeah, absolutely. Pain can be an indicator that tissue injury has occurred. We just saw that. When I fall and scrape my knee, it hurts because I've got this inflammation that's happening in my knee. But it doesn't always have to be that way. For example, we know that from imaging studies of the lumbar spine, of the low back, we've compared people that have a herniated disc, or people that have low back pain, I apologize, compared to people that don't have low back pain. So adults with back pain and adults without back pain. And what they've seen is that there isn't a huge difference between the folks who actually experience pain in their back compared to the folks who don't have pain in their back in terms of what we see on imaging studies. In other words, something like a herniated disc is just as likely to not cause pain as it is to cause pain. So if you have back pain and you've gotten imaging of your spine, and it tells us that you have a herniated disc, that only tells us so much. In some cases, it tells us that your spine is as to be expected for maybe another adult your age. So then the question is, what makes one person have pain and what makes another person not have pain? And that's what we're going to start to understand and unravel through the rest of this presentation. One of the things that we can think about as a physical therapist, I can tell you that sometimes how we move is going to influence whether or not we have pain. For example, if I scraped my knee and I just keep my knee straight with the scrape, I might not experience much pain. But let's say I scrape my knee and I still have to do a lot. Maybe I have to squat up and down, or maybe I have to wear rough pants against the scrape because of my job, that I might experience more discomfort in that area. Or maybe how I'm moving my knee could place more pressure on the scraped area compared to moving my knee in a different way. But it's not always as straightforward of just how we move our body affecting the tissue that may or may not be injured. So in order to get a better understanding, let's take a look at the nervous system, because the nervous system is what's going to process basically everything that we experience. So our nervous system is divided into two anatomical parts. We have our central nervous system, which includes the brain and the spinal cord. And those are pretty much the command centers where we send out lots of signals to the rest of the body and we collect lots of signals from the rest of the body. And then we have the peripheral nervous system, which includes all of the nerves that exist outside of the brain and spinal cord. So that's going to be all the nerves that go both to your skin, your muscles, your bones, your other organs. And those nerves are kind of like highways, two-way highways. They send information out to those places and they're going to receive information from those places. Our peripheral nervous system also has two functional parts, two functional divisions. So we have the somatic nervous system, which communicates to, mostly our skeletal muscles and maybe our skin. So it helps us move about and feel sensations. And then we also have the autonomic nervous system, which relays information to and from our internal organs. So if we think about the sensory nervous system, we can think about how there are many types of sensory nerves and receptors at the ends of those nerves that send signals to our brain about what we experience in the world. So earlier, when you were using your fingers to gently stroke your hands or maybe your face or maybe your neck, by the way, if this feels good, this is a great way that you can demonstrate physical care to yourself. That touch, when I'm gently stroking my face or stroking my hand, would be light touch. So that's going to activate certain sensory receptors in my skin that tell me about light touch. And then when I maybe squeeze my arm or squeeze my legs and I feel that pressure, that's going to be a different set of receptors that tell us about deep pressure. And then we'll try this next one together. If you take your fingernail and you bring it to the palm of your opposite hand, and you first just touch your fingernail to your hand, or if you don't have a fingernail, maybe you use something like a paper clip, you're going to just start to touch the sharp end of your nail or the sharp end of the paper clip to your hand, and you're going to notice first, oh, this is sharp. So that's your sharp receptors. And then you're going to press a little bit harder and you're going to notice, oh, now that's sharp and that's pressure. And then you're going to press a little bit harder and you're going to go, oh, that's sharp and that's pressure, and ouch, that's pain. And so the pain that we experience is when something in our body called a nociceptor gets activated. Now, what's interesting about nociceptors is that unlike something like your light touch receptors, which are only going to be activated by light touch. Nociceptors are going to have a lot of potential inputs because they are the receptors that tell us about a potential threat. And so they will then send signals through particular fibers up to our brain about experiencing a potential threat. So for example, if I were to take my hand and place it over a hot stove, again, first I might feel warm, then I might feel light touch, and then I'm going to feel, ouch, that's pain. And it's going to get sent to my brain. That signal will get sent to my brain. And my brain will have to process that information and then make a decision about what to do. And you saw me pull my hand away. But in that pulling my hand away, that's the peripheral nervous system or the somatic nervous system pulling the hand away. But there's now this whole cascade of events that's happened within my nervous system to determine what to do in response to this threat. And so that's the other part of the peripheral nervous system, the autonomic nervous system. So our autonomic nervous system, the part that communicates primarily with our organs, is also divided into two parts. So we have the sympathetic on one side. Can I move myself? I can. Great. So we have the sympathetic on one side, and we have the parasympathetic on the other side. Our sympathetic nervous system is often referred to as the fight or flight part of our nervous system. Sometimes you'll also hear it referred to as fight, flight, or freeze part of our nervous system. And so what happens when the sympathetic nervous system gets activated is our pupils dilate so that we can take in more information, take in more light. Our respiratory rate starts to increase. The bronchioles in our lungs dilate so that we can take in more oxygen. Our heart rate starts to increase so we can send more blood to our muscles. And our bladder actually relaxes so that we can continue to fill our bladder so that we might be able to escape any potential type of threat. On the flip side, we have our parasympathetic nervous system, which is often referred to as our rest and digest part of the nervous system. And so everything that happens when the sympathetic nervous system gets activated is the opposite with the parasympathetic nervous system. Our respiratory rate or our breathing rate slows down. Our heart rate slows down. Our pupils will constrict so that we can take in less light so we can fall asleep. Our digestive organs will begin to move food through our body. Our bladder might be able to contract so that we can empty our bladder. Same thing, empty our rectum if it's full of stool. So we're resting and we're digesting. Now, what's interesting is that our parasympathetic nervous system is always working at about the same level. So it's kind of like this white noise that's happening all the time in our body. And what actually changes throughout the day is how active our sympathetic nervous system is. And we need our sympathetic nervous system to get us through the day. We need our sympathetic nervous system to respond to potential threats. But what can happen is that when our sympathetic nervous system gets turned up really high, maybe we've got a lot of stress in our day, maybe we've got a lot of stress in our life, then we have a hard time tuning in to the parasympathetic nervous system. And it might be hard for us to rest, it might be hard for us to digest. And so you can ask yourself, what part of the nervous system probably gets activated when you experience pain. What happened when I put my hand on that hot stove? I got a little shot, a little increase in my sympathetic nervous system. And so if that's happening a lot throughout my day, I might have a hard time kind of bringing things back down to a level where they're manageable. And since we can't turn up the volume on the parasympathetic nervous system, we have to do things to turn the volume down on the sympathetic nervous system. So we'll try another activity here. You're going to notice that your body is making contact with a surface. So maybe it's your feet on the floor. Maybe it's your seat in the chair. Maybe it's your body resting against a bed or a floor or a couch. And then start to notice your breathing. Just take in how you're breathing without any sort of judgment about whether or not you're doing it in the right way. Notice where you feel your breath in your body. And first, just allow your exhale to get a little bit longer. And after your exhale gets a little bit longer, notice that your inhale may have lengthened also. And just take 3 more slow breaths. And then when you're ready, you can open your eyes. And we'll go back to this example of the hand on the hot stove. So I put my hand on that hot stove. My sympathetic nervous system got an increase of activity. My heart rate increased, my breathing rate increased, my pupils dilated. And with that information, my brain said, oh my goodness, there's a threat. And I pulled my hand away. Now, sometimes that can happen so quickly that actually no damage has been done to the tissues, but I still experienced pain. But now imagine that, oops, not yet, don't imagine anything yet. So a question for you is, can you experience pain without tissue damage? Yes, we experienced it earlier when we poked ourselves in the palm. We conceptualized it when we thought about pulling your hand away from the hot stove. And so what this leads us to ask is, again, what might be happening in our body when we experience pain? So if we think back to what's happening in the nervous system, the sympathetic nervous system kicks into gear when it experiences that threat. We think about all the same things that happen in our body when we experience the threat: our breathing rate, our respiratory rate, our pupils, our inability to rest, maybe our inability to digest, because now we're sending resources to other parts of the body that help to keep us safe. That's an important part to remember, is that all of these things happen because our body's trying to keep us safe. what we've learned from imaging studies of the brain is that similar parts of the body, similar parts of the brain will be activated when we experience pain, but also when we experience anxiety, when we experience stress. And when we experience all of these things, these can happen cumulatively throughout our day. They're going to start to build on each other. And the activity of our sympathetic nervous system has the potential to just go up, up, and up. And when we pass a certain threshold, it's going to be really hard to bring the activity back down. And so part of our practice is being able to identify, when is my sympathetic nervous system increasing its activity? And what are the things that I can do to help bring it back down? And that's some of the strategies that we are working on. So we'll take another moment. Again, maybe close your eyes. Again, maybe a hand goes over your heart or wherever your hands feel like they want to be. And just ask yourself, in this exact moment, what is it that I need right now? And you might think about the different types of needs that we have. We have physical needs. So maybe it's cold in the room that you're in. We have emotional needs. We have needs for rest. We have hunger. Once you've identified one of your needs, see if there's something that you can do for yourself. So maybe you're cold, maybe you grab a blanket. Maybe you realize you're hungry, so you're going to pause the video and go get yourself a snack. Take a moment to give yourself what you need and then check back in and just see, what does it feel like to actually meet my own needs, to recognize my own needs and meet them. So back to the hand on the stove. Imagine in this case that actually when I placed my hand on the stove, that I did, or maybe you did burn your hand. And so we actually did experience tissue damage. That pain we would expect would be pretty intense and would probably last for a while. But then you turn right around and you see that there is a lion in your kitchen. Does your hand still hurt? Probably not. And your hand doesn't hurt because the moment you see a lion, your brain knows that there is something else to deal with. There's a bigger threat to deal with. And so what that tells us is that our pain is also related to our context. So if, for example, I am sitting in a room and noticing that I'm in pain, and all I am thinking about is my pain, I can expect that my pain is going to be worse. Or maybe another way to think about this is when you first began experiencing pain, there was a specific context that was happening in your life. Maybe it was something that was happening in that exact moment, or maybe there were things that were happening in your life that were affecting your nervous system. And those things are either going to help you manage your pain more easily. So let's say I go back to the knee example. If I fell and I scraped my knee, but I'm with my friends and I'm having a good time and it's not during a pandemic, so we're not wearing masks, I might laugh it off. My knee might hurt a little bit, but it's not going to be that big of a deal. But let's say that I was running a marathon and I was in first place and I was about to cross the finish line and I fall and I scrape my knee and hundreds of people are watching, and then all my opponents pass me up, that knee is probably going to hurt a lot more. And so we can think about our context as we respond to our pain. When you notice that your pain is increasing, take a look around. What's happening around you? What's been happening in your life the past few days? What are you doing with your body? What's going on emotionally? And see what types of needs you might be able to address for yourself. Now, the other thing to consider is that in this case, where I see a lion in my kitchen, my sympathetic nervous system is going to kick up again. And when our sympathetic nervous system kicks up for a short period of time, it actually allows us to manage pain really, really well, because that's how it's designed to work. But when our sympathetic nervous system stays really elevated for a long period of time, then we actually have a harder time responding and managing pain. So we've touched on this already, but can you have tissue damage without pain? Yeah, we saw that with the lion. Other real life examples that you may have heard of are phantom limb pain, or if we think back to that imaging study I told you about, looking at low back pain paired with the incidence of herniated discs, we can have damage to our tissues but not experience pain. So take a moment to think about maybe some of the contexts in your life that might influence your pain one way or another. You might even write it down and think about things that help my pain. Or maybe we make it a little bit simpler, things that help me feel good in my body. Maybe not specific to your pain, make me feel good in my body. And maybe things that don't make me feel good in my body. And you might start to grow this list over time and refer back to it as you begin to navigate or continue to navigate, maybe for some of you, living with your pain, managing your pain, and hopefully in some cases, improving your pain. So another really important thing that I've started to touch on as I've talked about things like managing your pain, noticing your context, developing a practice of listening to your body's needs, is this concept of something called neuroplasticity. So neuroplasticity is essentially our ability for our nervous system to learn something. And so a really clever way of remembering that concept is neurons that fire together wire together, because neurons are our nerve cells and they send electrical signals primarily to each other and to the brain. And so they're firing off these signals. And the ones that we use a lot get faster and get better and get stronger. So for example, if you've ever learned a skill like playing the piano, when you first learned that skill, you probably were not very good at it. And then over time, as you begin to practice, you didn't have to think so hard about what you were doing, that you were able to just execute the skill really easily and maybe really quickly over the course of time. So just like you can learn to play the piano, your body, your nervous system can also get good at sending pain signals, at becoming sensitive to different types of sensory input that your brain might experience or might interpret as a threat. And that can at first sound a little daunting, like, oh no, I have learned to be in pain. I've gotten good at being in pain. But just the same way that you learned it, you can unlearn it. You can train your nervous system to respond differently to the types of threats that it experiences. So you're not necessarily, you might get to a point where the one pain that you're concerned about right now goes away completely. But you more likely are probably going to get to a point where your nervous system just won't be quite as sensitive to it. And the intensity of the signals that it sends will get less intense. And all of that comes from both maybe the things that you might work on with a physical therapist, right? How do I change the way that I move so that maybe I won't irritate these tissues that are so sensitive? And if you aren't already working with a physical therapist, or if you haven't in the past, or maybe you have in the past, maybe it's time to reach out again, or for the first time. But it also comes with remembering that when you experience pain in your body, that this is just a message. This is a message from your tissues to your brain. And that message to your brain is going to have a very specific response or effect on your whole nervous system. And that's also going to be influenced by the other things that are going on in your life. And so what we're learning to do and to develop in this presentation is just the beginning of starting to identify some of those signals and making some sort of intervention for our nervous system to become more efficient at responding appropriately to the signals that it's receiving. So here's an overview of some of the strategies that we implemented or that we discussed. So they can happen, these are just some of the things that you can start to do to give your body what it needs, allow your nervous system to settle, because pain is going to increase the activity of the nervous system. We talked about giving yourself physical care, giving yourself emotional care, slowing down. That might mean just noticing your breath. It might mean actually slowing your breath. Maybe breathing isn't a good intervention for you. So it could be taking a moment to look out the window or drink a cup of tea. Ask yourself throughout the day, even if maybe your pain is not bad, what do I need? And get in the habit of giving yourself what you need, because your body's always giving you signals. And then you change your context, and you can do that in different ways. I wouldn't recommend turning around and looking at lions from an unsafe distance, but maybe it means turning on some music that you know brings you joy. Maybe it means taking some time to call up a friend that brings you joy. Finding a creative outlet to help to bring down, to process maybe what's happening in the nervous system. There's lots of different ways to change your context. And then one more strategy that we haven't yet mentioned, that we haven't yet talked about, is moving your body. So what we know if we think back to the context of a lion, right? Our body is really good at managing an increase in sympathetic nervous system activity, fight or flight activity for a short period of time. And what our natural response is in those moments is to move our body, to run away from the threat. But our bodies and our nervous system doesn't always know the difference between a threat that is a lion ready to chase us out of our kitchen, or maybe a global pandemic, which is when I'm filming this video, or maybe a really important deadline at work. All these different inputs might be processed in the same way. And so that might be why one of the bits of advice you may have gotten at some point in your pain journey is to move your body and to increase your heart rate, because that's actually our natural built-in mechanism for dealing with all the things that happen as a result of an increase in activity of our sympathetic nervous system. But sometimes moving our body and getting cardiovascular exercise isn't feasible. Maybe our injury prevents it. Maybe our pain prevents it. Maybe it's just bedtime and it's not a good time to go for a walk. So we're going to try another strategy called progressive muscle relaxation, which, similar to moving your body, cardiovascular exercise gets you to contract and relax your muscles the same way you might if you were getting exercise. So for this activity, I find it particularly helpful to do lying down, but you can do it sitting in your chair. So we'll go ahead and get started. Once you've found yourself either in your seat or lying down, take a moment again to just notice, could I make myself 5% more comfortable? And then allow yourself to do it. And then close your eyes if they're not closed already. And begin to become aware of the fact that you have a face. Start to notice the sensations all around your face. And then begin to become aware that on your face you have muscles. They go around the eyes, they go around the mouth. And ever so slightly, maybe with 20% effort, begin to engage those muscles. Like you're trying to make your face really, really small, constricting the eyes, constricting the mouth. And take a moment just to notice how that changes the sensations in your face. Notice what it feels like to hold tension in those muscles. And then slowly begin to release the tension of those muscles and let them be loose and heavy on your face. And then draw your awareness down into your chest, into the space between the collarbones. And ever so slightly begin to let the fronts of the shoulders come forward, like you're trying to make your chest concave. Again, maybe just 20% effort here. Notice what it feels like to hold tension in those muscles. Notice the way it affects your breathing. And then slowly begin to release it, let it go. Take a moment just to notice the difference of those muscles engaged versus those muscles soft. and loose. And then become aware of your arms. Notice the sensations around your wrists, your fingers, your elbows, your shoulders. And we'll begin to engage those muscles of our arms by gently curling the fingers in like we're making fists, bending the wrists, and imagine you could bend and straighten your elbows at the same time. Let the shoulder blades draw gently up towards your ears and slightly together on your back. Notice what it feels like to keep the tension in these muscles. Feel the warmth of the blood rushing to these muscles. Feel the rigidity of your arms. And then as you're ready, begin to release the effort of those muscles. Let your shoulder blades hang. Let your arms be limp. And then draw your awareness down into your belly. For a moment, just notice the belly. Notice the center of the body. And then begin to notice the whole area between the rib cage and the pelvis, on the front, the sides, and the back of the body. Then begin to engage the muscles of the belly like you're trying to narrow your waist and draw your belly button in towards your spine. Again, just 20% effort, just allowing those muscles to firm. And notice how that changes the sensations all around the center of your body. Notice how it changes your breathing. And then as you're ready, slowly begin to relax the muscles of the belly. Allow your breath to flow in. Let your whole belly be soft. And then begin to become aware of your legs. Noticing the sensations all around the hips, the knees, the ankles, the toes. And then begin to engage the muscles of the legs, curling the toes in, maybe pointing the toes down. Imagining bending and straightening the knees at the same time. Maybe squeezing the outer hips inwards so that the glutes firm. Again, notice the rigidity of your legs. Notice the warmth of the muscles. Notice what it feels like just to hold tension in your legs. And then as you're ready, slowly begin to release the activity of those muscles. Let your legs be loose. Let them be heavy. And then take a moment to notice your whole body. Feel the sensations of your whole body and notice, is there anywhere that I'm holding tension that I don't need to hold tension anymore? And as you're ready, you can begin to let go of that tension. And so you can notice what's begun to shift for you, or what did shift for you as you moved through your body, holding tension in the muscles and releasing. You can maybe notice what the sensations in the body feel like, but also what's happening in your mind. And remember that the same way if you were learning a skill, like learning to play the piano, that as you learn, it will take practice. And that as you learn, you may make mistakes and it might not sound very good all the time. But the more you practice the piano and the more you practice care for yourself, the easier it gets, the better it sounds, and the better you feel. So when you're ready, you can open your eyes. The next few slides will just be a few different resources that you might be able to turn towards. Again, if you're not already working with a physical therapist, or if you haven't in the past, it might be a good time to reach out again. These are all free videos that you can find on YouTube. These two, Why You Hurt, go into a little bit more detail about understanding the nervous system and how to make change over time. And then the last three are videos to help you implement the strategy. Progressive muscle relaxation, like we just did, a body scan, which is another way to release the tension of the muscles, and then a self-compassion meditation with Tara Brach. And then there are some books, and I just want to mention that I don't have any sort of investment in what resources you turn to, and there are many resources out there that can help you understand your nervous system. These are just the ones that I've read, or a few of the ones that I've read. So Explain Pain is a really helpful book that goes through pain and how it affects the nervous system. Yoga and Science in Pain Care also talks about how pain affects the nervous system, but also is a little bit more practical in giving you different strategies, particularly if you're interested in a yoga or meditation practice. Why Pelvic Pain Hurts can be particularly helpful for folks experiencing pelvic pain. And then Burnout and The Body Keeps the Score are not pain specific. Burnout is about essentially the stress cycle and the nervous system, particularly targeted towards cisgendered women. And The Body Keeps the Score talks about how our body might respond to some of the contexts that we've experienced throughout our whole lives, and what types of patterns those contexts, particularly surrounding trauma, may affect what's happening in our body. As you work through some of these resources, you might also start to think about, in addition to physical therapy, what are some other resources that could be helpful for me in managing maybe my physical needs and my emotional needs? Maybe it's talking to a nutritionist, maybe it is working with a therapist to give you some more guidance to learn how to care for yourself better. This Curable app is specific to folks with pain. It's created by 3 folks who have dealt with persistent pain, and it's based on evidence of mind-body strategies. So it can be a really nice resource. And then there's 3 just meditation apps. Again, there are lots of different meditation apps out there, so you might find one that fits you better. And then these are just two different podcasts that talk about pain. So if you are just curious about, free resources to help you learn about different strategies, different people's experience with pain, these might be good options. So that wraps up today's presentation. I hope that you have learned a few things and that you are walking away with a little bit more of an understanding about what happens for you when you are experiencing pain and what you can do to take good care of yourself in this journey. Feel free to reach out to Back to Life if you are interested in working more one-on-one with a physical therapist if you're not already.